Hello and welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks so much for joining us for our program today. It's called Strengthening America's Healthcare System. So we all need to strengthen America's healthcare system, but it's a lot of different views on how to do it. Over the next hour, we're going to examine the current state of American healthcare and ask how it can be improved for all patients with an eye to the future. Before we begin, I'd like to thank our sponsor, the Partnership for America's Healthcare Future, for supporting today's conversations. More than a decade after the passage of the Affordable Care Act, a record number of Americans have access to health care coverage, but millions still remain uninsured. Today's program will look for answers to crucial questions like how can all Americans have access to quality, affordable care? How can stakeholders from across the health care ecosystem begin to collaborate to strengthen the Affordable Care Act and improve patient health? And what role can policymakers play in addressing issues like coverage, cost, and barriers to access? Before we hear from our fantastic speakers, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillHealth. The hashtag is way more important. We're broadcasting live and we'll be taking your questions throughout the program. And I always say this, as with any live stream, if it goes wonky on you, don't throw your computer out the window. Just refresh the page and hopefully it will fix the problem. My first guest is Congressman Brad Wenstrup from Ohio. He's a great friend of The Hill, often talk to him about big health care issues. Brad has been a physician himself for more than 30 years. He's co-chair of the GOP Doctors Caucus. Congressman Wenstrup, it's great to be with you again. Look, I want to just ask you point blank. We've discussed health care, you and I, so many times. And I have been reading something you've been saying, we need to stop talking about lifespan and think about health span. And I'm interested in what that Wenstrupian comment means.
Well, I'm glad you went to that first, because I think I would have tried to go to that as the overarching theme, right? And then we start getting into the details of healthcare. You know, so what do we want success to look like in America as far as health? We want our citizens to be healthy. That is probably the most important thing. So how do we go about doing that? You know, we can get into all the details. We need providers, we need this, we need that, we need access, we need transportation to the doctor, to the hospital, whatever the case may be. But health span versus lifespan. And actually in America, we do pretty well when it comes to lifespan. If you think about it, outside of, unfortunately, suicides and drug overdoses, we can keep people alive for a pretty long time. So I always want to talk about health span. How do we maintain people, even people with chronic diseases? How do we keep them healthier longer? I always sort of tongue-in-cheek point out that none of us are getting out of here alive. So how can we keep us healthy as long as we possibly can? And for those that want to be talking about the cost of healthcare, that's really where the savings is, because the more you can keep people healthy, the better off that we can be. So I look a lot at preventive care, preemption on things, early diagnosis, those types of things, along with innovations and cures. And then, of course, having it affordable. So, you know, for all Americans, we want access to quality care, access to the treatments that are available, and we want the development of new treatments. And in that vein, keep people as healthy as we possibly can. I know you and I have talked about in the past, even down to the grade school level. Are we really doing the best job that we can on health with kids? Are they growing up really knowing what are the best foods to eat, what is best for them, and why they should be eating certain things and exercise, all those types of things we really need to take a look at. But it's about keeping people healthier longer, and how do we go about doing that?
Well, you know, I think one of the things you're talking about is so important, Congressman, which is, you know, people having a relationship with their doctor, with the healthcare system that's ongoing. And, you know, I often criticize, I mean, you and I have talked a lot about government, foreign policy, and my criticisms of government is when that government is defined by being reactive all the time to incidents that happen, as opposed to being strategic. I think that probably, you know, and I know you think of this, it also applies to healthcare. Like, how do we be strategic about, you know, what do we do to, you know, deal with obesity in this country in a real way? What do we do to look at some of the chronic conditions, as you said, as opposed to just reacting at that moment when someone's health begins to quickly deteriorate? Do I have that right? Is that and how many of your colleagues are willing to begin thinking about health span as the model, as opposed to a reactionary model in health?
Well, you know, I think that it's kind of been the same old, same old. We've been a system of break it, fix it, break it, fix it. And I think people are starting to catch on more and more. I can tell you the doctors are. You mentioned that I'm one of the chairs of the GOP Doctors Caucus, but we are often in conjunction with the doctors from the Democrat side. I've got bills that we passed and some that we have in the works that are very bipartisan, and surprise billing was one of those. So we need to drive along in that direction, and we do get that done. But outside of healthcare providers in Congress, a lot of that is lost on them because sometimes it's like, well, I don't really understand what you're talking about. So we need to educate everybody on what is taking place in the healthcare arena. And you're right about government. Oh, there's a problem. Okay, let's fix it real quick. Well, let's try and not have to fix it. So one of the analogies I like to use, Steve, is, we give a lot of credit to the cardiothoracic surgeon that cuts you open and saves your life after your heart attack and gets rid of the blockage, and you live again. And that's a wonderful thing. But we don't give enough credence to the doctor that prevented you from ever needing that procedure because we kept your heart healthy and you did all the right things and you took the right medications and got your periodic checks. So think about this as we go forward. A lot of people, they budget with their health care. And so they may have insurance and may be considered to be really good insurance with access to a lot of great providers. But there are times when they say, you know what, well, I'm not going to go to the doctor. Why? Because, well, I have a high deductible, or I have this copay, and I really can't afford that this month, or whatever. Well, what if you got one well visit a year with your primary care doctor where you didn't have to pay a copay or go towards your deductible? Why? Because you want to be ahead of things. Or if you have a chronic disease such as diabetes, or there's so many of them out there where you need to be seen by your doctor on a regular basis. Okay, well, maybe to incentivize you to make sure that you go to the doctor and stay as healthy as you can, that you reduce that copay, or there is no copay, because it's far more of a greater savings, if you will, if you go to the doctor and you keep things under control rather than not going. Things get out of control. Now you're in the hospital. Now you're sicker. So we got to start thinking about some of those things where we're really striving and stress the importance of keeping people as healthy as we can.
Brad, let me ask you a question about the social contract around health. Now, I should address you as Colonel Wenstrup because I want to tell our audience that you're a colonel in the military reserve, in the Army Reserve. You served in Iraq. You won decorations for that, and you're very intimately, and you had a private practice for many years. So you know the doctor side of this, and you also have a connection to patients. And I'm just sort of interested as we kind of look at that. What are we missing in this conversation when we get down to that patient level? And they see today in today's world, vaccine mandates. They see, questions about how much is out of pocket for them. They hear about it's a confusing health, turbulence out there for people. What is broken for that patient that we have to begin to get better than we've been doing? What is your suggestion to the Biden administration on how they lead in this and how they fix some of this?
Yeah, and it's not just the Biden administration, really it's us in Congress as we work together. I mean, when it's not always seen what happens with patients. I have a patient that I had to see on a regular basis. He's diabetic, and he often had breakdowns and ulcers on his feet and things like that. We always wanted to be a step ahead of the game. I need to see you regularly. And then one time he said to me, I'm not going to be able to see you anymore because the bus that I take, it doesn't come here at the right time and allow me to get here and then to dialysis. So, and I'm thinking, I said, no, that's not going to work. What time do I need to be here to take care of you? And so we made that adjustment, right? So there's a lot of things that just have to be addressed, but they're almost a one-on-one. But we're starting to see things. Let me just use that example, the diabetic with end-stage renal disease. If we can have a one-stop shop, okay, where you can go and all those caregivers are in the same facility at the same time, that's a tremendous thing. And so, we start looking at outcomes, okay? So, and we're seeing some of that, right? Where, your reimbursement or whatever is going to be based on what kind of outcomes that you have. And I think it's important that we continue to drive in that direction. Scientifically, Steve, there are so many things that we are doing now to monitor patients, say around the time of surgery. You can go home with a pulse oximeter oximeter, and we can know if you're getting any respiratory problems after anesthesia. And we can know right away, so we nip that problem in the bud rather than, hey, I'll see you back in the office in 2 weeks. We're doing more outpatient type of surgery, so that's good. But let's not lose track of monitoring the patient every step of the way. So a lot of things are going in the right direction. We get stymied a lot of times on prior authorization, things like that delays care. You see the patient, you're the doctor who saw the patient, you recommend a treatment, and now you have to go through hoops with the insurance company and talk to people that never saw the patients and sometimes aren't even physicians. And that's very frustrating. It's a delay in care for patients. And so we have a bill out there, Seniors Timely Access to Care, that addresses that. And then, things like with what you prescribe, and the insurance company says, no, we want you to use this other drug first. And you're like saying to them, but that's a contraindication. You don't know this patient has this other medicine they're taking. I mean, it gets very timely, and there's so much reporting that we have to do. It gets more and more tired. I would say on a bipartisan basis, of the doctors in Congress, we met with the Surgeon General yesterday. The first thing he wanted to talk about was clinician burnout. And so we really have to make the job more enjoyable for physicians again, because they're going to start retiring. And now we've got issues coming up right now on our plate where Medicare reimbursement is about to drop for providers. And there's only so much you can drop, and there's only so much volume you can increase. And so it's getting tougher and tougher. And we got to make sure that we have providers out there too. That cannot be assumed. And so those are some of the things that are on our plate. And it all comes down to patient care. Yeah. And that's really who we're here to advocate for, is to be able to take care of our patients. We want to be able to reestablish the joy of taking care of patients.
Well, your comments about, doctors and clinicians falling out of the system, retiring, stepping out, saying we've had enough. I mean, I read about it all over the country, all over the time, in Florida and Oklahoma and California. I mean, you see it everywhere. You have characterized President Biden's Build Back Better plan as the Build Back Broke plan. And I'm interested in, you said it's mostly pain and no gain. If you were to get in and tinker and move elements of that plan around, particularly the health provisions that are in there, how do we get I always kind of frame things, how do we get gravity moving in the right direction from your perspective? Now, a lot of people are arguing about, which direction we could go, but I'm just sort of interested, what creates mutual reinforcing, cascading positives in American healthcare versus what I think you've been saying is, hey, this is the wrong track, this creates more negatives than positives?
Well, I think one of the things you can look at right away is with the price of drugs, and what's in that plan that is absolutely going to drive innovation out. And what people have to realize, when a new drug or a new cure is out there, it comes with years of research and a large portfolio of ideas that finally come down to one that may get through the FDA and get approved and save lives and this and that. So if we're making it so difficult for new drugs to be manufactured and innovated, they're going to leave. And we want those to be made here in the United States, and we want the innovation to continue here in the United States. And that bill, as written, is going to drive people out of the United States and stymie innovation. And they all will tell you that. I know there's the fine line. It's easy politically to say, well, these pharmaceutical companies make big money. Well, they also put big money down and take a lot of risk, and sometimes they don't make it. So there's that. How do we thread that needle? But the drug bill that's in there right now is just going to tax them to death, and they're going to leave. And also, as we look at what we're talking about now, is when we had the Tax Cuts and Jobs Act, yes, we did reduce taxes, and it wasn't just for the top 1%. It was across the board. And you had no inversions. You study business enough where you sit, Steve. You get it. You want American companies, but we had no inversions since that went in. And revenue to the government went up by cutting taxes because more people were employed than ever before. Businesses were growing. You talk to some of the pharmaceutical companies during that, they were expanding and increasing their workforce and working on new developments and new drugs. This will do just the opposite. And to me, that is pain without gain. And so we shouldn't just be demonizing so many entities of the healthcare arena Well, I'll give you an example. See, when I first started in practice, here I am, $200,000 in debt, and all I kept hearing as I picked up the paper every day, and this is in the late 80s, is greedy doctors this, greedy doctors that. And I'm like, excuse me, I'm $200,000 in debt. And I'm not making that much because I'm starting with a small practice with 2 employees, and if someone's sick, my mom comes in. And so, and I also want to have the opportunity for that type of medicine to be there as well. I represent a lot of rural America, and they need the old country doc that can take care of you on a regular basis. And the way we are evolving now, it's much more difficult because of so many regulatory burdens that a solo practitioner or a 2-doctor practice cannot afford. And so they end up quitting or going to the cities. And so we got to think about all of America when we think about our healthcare environment.
Well, listen, folks, a lot of people know our guest is Congressman Brad Wenstrup. Others know him as Colonel Brad Wenstrup, but today he's Dr. Brad Wenstrup. Thank you so much for your realism and your candor, Representative, and thanks so much for joining us as always.
Good to work with you on these issues, Steve. I appreciate that. There's a lot to do and a lot we can do. Thanks.
And now to further explore how providers, payers, and patient communities can work together to improve health care for everybody, I'm pleased to be joined by a panel of really great experts. At least I hope they're great. We're going to find out. Dr. Irfan Asif is Associate Dean of Primary Care and Rural Health at the University of Alabama at Birmingham School of Medicine. Virginia Fields is founder and CEO of the National Black Leadership Commission on Health, and Melissa Schulman is Senior Vice President of Government and Public Affairs at CVS Health. Transparency, I'm a client. I go to CVS Health. So, any pharmacy that's nearby. But great to be with all of you. Let me just start with Dr. Asif. Let me ask you a question. The law of the land is Obamacare. It is Affordable Care Act. And, I used to work on health care policy in the Senate in the 1990s. And at that time, we had somewhere around 13 major revisions in health care, but they really didn't increase the number of Americans that were covered by some form of health insurance. Obamacare did do that. It's left a lot of people still off the grid. But I'm wondering if we're going to take the law of the land and we're going to make it better so that it's more practical, that some of the glitches in it are fixed, that we find people having more accessibility in that. What are some of the things that you think would be advisable to consider from your perspective as a practitioner?
Yeah, that's a really great question. So access to healthcare is a major issue. And some of the things that we need to think about are how we can increase the pipeline of folks who can help with creating access. So the pipeline maybe of primary care providers that might be able to help with facilitating more access. But part of the issue is that if we don't have a system that's incentivized to provide that access, so if we have a fee-for-service model, we're not actually incentivized to prevent disease, and we're going to be incentivizing people to go into professions where they're treating disease rather than trying to just prevent it. And so again, trying to have a system where primary care is incentivized, I think that's the backbone of what we need to work towards. Some of the other things that I think we should include are really trying to change the payment model. So right now, the payment model is a fee-for-service model. And so we need to think of capitated systems or value-based systems that might be able to incentivize people to go into primary care. At the moment, particularly in Alabama, we have a huge shortage of primary care providers, and some of this relates to the payment reform.
Just before I jump to Virginia, the same question, when you talk about the shortage of workers, and I also want to I keep reminding everybody, we're not out of the COVID crisis. We're still in the middle of the COVID crisis. And I keep hearing about frontline health aides, frontline doctors, frontline nurses, those folks in there are leaving because of exhaustion, morale, et cetera, in this period of pandemic. Can you give us a snapshot of what the stakes are and what we need to do to get it right?
Yeah. Really...
Well, Virginia, give me a second. We'll get Dr. Asif, and I'm going to jump to you.
Sorry.
No worries.
Yeah, no, you're totally right. I think people are very stretched with what the COVID pandemic has brought to us. We're certainly stretched with physicians, staff, nurses, everyone on the front lines, as you mentioned. Hopefully with the vaccinations, people can start to see the light at the end of the tunnel. COVID has allowed us to do some unique things, though. When we think about COVID, it's brought things like telemedicine to light, so allowing us to have more access for people in other parts of states or across the country. You end up with some new issues, though, around potentially health disparities. For example, some people may not have access to broadband, so connecting to that digital health may be another issue that we have to tackle down the road. So for me, the framework that I think about in terms of addressing the needs, getting back to your original question, I think that a payment reform is important, having good access to care, as you alluded to, thinking about the workforce and not just of physicians, but the team that can take care of a patient or a populations, and that team might include nurses, physician assistants, behavioral health, social workers. I think digital health is a big part of this, so thinking about how we can provide access using our digital health technology.
Right.
And then accountability, so trying to think about ways that we can all work together, whether you're inside or outside the medical profession, to provide these services.
Right. Thank you. Virginia Fields, I'd love to ask you this, but I want to tell our audience that you're not only founder and CEO of the National Black Leadership Commission in Health, but you were also president of the Borough of Manhattan, where I spent a lot of time 20 years ago. You're a member of the New York City Council, so you have a very tangible understanding of major urban centers and the health deficit. So let me ask you the same thing. What are the blind spots that we need to rectify in our understanding of how to fix the healthcare system today?
Well, I don't know so much about whether it will fix it, but one way of things that we can certainly do to get more people insured is directly related to political will and coming from the political side of it. Political will to move on some really good options that are out there that we heard about during the presidential campaign and we continue to hear about now through Congress. But we need the political will in order to get people insured. And when we look at, I think it's still about 12 states, mostly southern states, that have not expanded Medicaid, that creates dire problems for people living in those areas in terms of access to good quality healthcare. And with most of those states, at least six, over half of them being in the South, Alabama, Georgia, Tennessee, I think Texas, South Carolina, North Carolina, Mississippi, of course. People living in those areas, and COVID has certainly shown us that they are the populations also disproportionately impacted by all of these diseases that have made them more vulnerable to COVID. So it takes the political will to act that if those states are not going to expand, there are some options out there, including expanding Medicaid premium care for people who are below the poverty line. So just reading about a lot of this, and it takes a lot to keep up with everything that is going on because things are moving so fast. But I come to this from the standpoint of how do we get more people insured so that they can receive the help that they need. So political will is one thing. The second point I want to make on this issue is education. I think we need to have more comprehensive education directed to people who are uninsured about what options they have, about the benefits that are available, and helping them become insured, even to the point of helping them fill out applications. I work on the ground. My office, we're boots on the ground. So we see this. People do not know, even though there's a great deal of information out there about resources, services, and we make assumptions that everybody knows and that everybody is aware of this, but it is not true. So education, very comprehensive, not just at a time when medical plans are expected to be renewed the end of the year. So let's do more education and awareness, and we can use data to tell us, to show us the zip codes in the areas where we have large uninsured populations. Right. Let's get in there and do some real work.
Virginia, I want to ask you a quick short form, and then I want to jump to Melissa, and then we're going to take an audience question. But you've said something so important, which is kind of address the information deficit that many people have about healthcare. And I guess I want to know, as we kind of talked about the politics of COVID and how it hit different communities disproportionately in America, This country spent billions of dollars, lots of money, to find trusted ambassadors, to find news ways, to find new ways to distribute and educate regarding COVID, particularly into communities of color and particularly into communities that were on the edges of the healthcare system previously, to try to make sure that they were reached. Is there anything they did that impressed you, or do you find what we did ineffective? And if you did find it effective, can we learn from it in achieving what you just said is so important?
Yes, it was certainly effective. Let's start with those trusted bodies in the communities, not only our faith-based institutions, but where people live, reside, where they go to barbershops, beauty salons, nail salons, wherever they are. Let's identify people in those spaces whom they trust. Daycare centers, people trust people in the daycare centers, and community-based organizations, because mobilizing communities is what we do all of the time. So now pivoting in order to do the work around COVID is very important and very effective.
Well, thank you. Melissa, CVS Health is one of the largest networks of provision of health goods. You're the front face of dealing with a lot of families. I think one of the things going to be a bit to what Dr. Asif just said, and also Brad Wenstrup, Congressman Wenstrup, said part of this is, promoting a kind of routinized, regular interaction of people with their health future, giving them agency. And I'm just interested in your perspective. You're trying to fix our healthcare system, the law of the land as it is. You try to, get more people in the system, get more people access to drugs they can afford and whatnot. What are the elements of that you think are important that we consider in fixing the current system we have?
Well, I think both Dr. Asif and Virginia hit on a couple of really important themes, but I noticed neither of them mentioned pharmacists. And there has been, I think, one of the things that we have learned from COVID is, one, I agree strongly, it's unleashed the power of what telemedicine can be.
Right.
And the broadband inequalities across the country is going to be key to making telehealth really work. But I think what we've also seen during COVID is whether it's somebody coming in to see their nurse practitioner at a minute clinic, or talking to their pharmacist, getting their COVID vaccination or getting their COVID test, is that companies like ours are really in every community. And the access that we can help provide to the people who need it is really something that we've seen used in COVID, I think, in an enormously effective way. Health equity was one of our guiding principles during COVID, as we looked at both testing and as we looked at vaccinations. So we were making sure that if we didn't have a facility in a community, then we stood up a community testing center. We made sure that as we were looking at vaccinations, particularly when the vaccine supply was more limited, that we were taking into account health equity as we were activating stores. But I also think that there are a number of provisions, with all due respect to Congressman Wenstrup, in the Build Back Better plan that actually do really help access. And Virginia hit on some of those, right? So whether it's additional funding to support people in non-expansion states who would not otherwise be able to get on the exchanges, the premium support provisions that are in the Build Back Better plan, again, which will help get people onto the ACA and help get them coverage, I think are enormously important, particularly right now. And I think the other thing that particularly our company is looking at is trying to provide care in the community in a different way. It's another way to improve access. So, for example, we're piloting mental health assistance in our health hubs in a few different states. So unfortunately, one of the problems sometimes with addressing mental health is being able to get to a practitioner. So we have a program where there's somebody in the health hub that can help you do that. I think the other thing to think about in improving access and helping with affordability is looking at different sites of care. So if you're an oncology patient, get your infusion done at home, as opposed to having to go to the hospital where you may be at greater risk for infection. Home dialysis is another growing area, again, where by changing the site of care, you're not only increasing access, you're also increasing affordability, which helps benefit the system, not only from the point of cost, but more importantly, from the point of health outcomes, because people are actually able to get the care that they need.
Melissa, we got a question coming up. We're always out of time with these great conversations, so I want to come back and get you all to respond to our questioner. But I want to ask you, Melissa. I mean, you were considered one of the top congressional staffers at one point in your career in this health space, and I just want to ask you about the literacy of our Congress on these issues. And because I sometimes feel there's sort of a whack-a-mole game going on in healthcare, so that rather than thinking comprehensively how we get this ecosystem to function better, to fix what we've got kind of a lot of silver bullets is the wrong metaphor, but people looking for just one part of it. And I'm just wondering what you think can be done to up an understanding of the importance of getting a comprehensive picture right in the policy space in Congress versus, somebody having fads that they care about. Does that make sense?
Yeah, it does. I guess I would disagree with you a little bit, because I think on both sides of the aisle, there are members of Congress in both the House and the Senate who are very invested in healthcare and healthcare policy. It's certainly, it's not all of them, but it doesn't have to be all of them. And I think, Congressman Wenstrup, the experience he brings as a physician to the conversation helps inform the debate. I think there are a number of expert staff on the committee and a number of expert members who have really made it their life's work as a public service to help improve the healthcare system. So I think that makes a difference. I would go back to both my time currently as a lobbyist, but also my time on the Hill. I'm a big believer in show and tell. We love for elected officials to come into our pharmacies and see how we are doing vaccinations, see how we're doing testing. Let them see how we have a savings program at the pharmacy counter to help people find a lower cost drug. Come and see what happens with a Minute Clinic. Let's show you what happens with our mental health. And as we're providing more and more primary care through our community presence, that's something we very much want members of Congress, the House and the Senate, and local legislators to come and see.
Right.
I think it's, and the same is true, it's taking the time to go visit your local hospital, to meet with the other healthcare providers in your community. I think all of that helps inform the debate. And then at the end of the day, talking with your constituents. They're the patients, they're the ones accessing the system, and getting their viewpoints as well, I think also helps to inform the debate. I am one of those who still believes that Congress is one of the greatest institutions, and that an incredible amount of good can happen there.
Right.
And I think that oftentimes the debate is far more elevated and far more informed than sometimes I think the public gives them credit for.
I think that's very fair. I think that's very fair, and I largely agree with you. Sometimes I wish it were a little more elevated, a little more informed, but we can agree to play with that on the edge. But we have a question from our audience.
We'll agree with that point.
Yeah. Okay. We have a question from our audience from Kevin Fahey. He's a consultant. Kevin?
How do we get to a system that is focused on improving people's health and the economy for everyone, and not just those in the health business?
Okay, that's a provocative question. Why don't I start with Dr. Asif? Dr. Asif, I think, and we never require people to agree with the question, but what are your views on how to make this about the patients in healthcare? And there seemed to be an implied criticism of the health business.
Yeah, to me, the answer is to train individuals in the communities with which they're going to work. So a lot of training happens in places where it's access to a big medical system, but I'd love to get out into rural or other underserved parts of the state and provide training so that they get to know those communities. They're a part of those communities, as a member of that community and someone who's serving, I think if they're trained that way, they'll start to understand what are the issues that are commonly faced and be able to address those firsthand.
And let me jump to Melissa real quick, and we'll end with Virginia. Melissa?
I mean, I work for a company that kicked tobacco out. So we think about the patient every single day. And so whether I'm talking to my colleagues at retail, at Caremark, or at Aetna, What we're focused on is improving the health outcomes for our members and for our patients every single day. That's what motivates our people. I work with amazing colleagues who have essentially vaccinated the nation. And that sort of spirit and commitment, at least at CVS Health, runs through every conversation we have. How does the member experience it? How do we make it better for the member? How do we help keep people healthy and get them healthy if they're not?
And Virginia, I'm going to give you the last word, but in this, I'm going to piggyback on this question and ask you something from your experience, because I find that some Americans, like our questioner, doubt the intent of this issue. But I've seen immunotherapy develop. I've seen continuous glucose monitors get developed. You know, I have a sense of the innovations, and I've often told my friends in the business of healthcare, talk about your failures as much as your successes, so that people understand the give and take in there. And I'm just interested in how, you know, many of the constituents that you worry about their healthcare, how do we both up the game for them, make it about them, but I'm also interested in how we educate people, you know, as well as about, you know, the wins and losses in healthcare.
Communicating, going out into the communities, engaging, especially constituents as elected officials. Go out into the community so that you fully understand what they're struggling with. Not only, again, COVID has lifted the veil on so many problems directly related to lack of access to care and how people are waiting so long to seek services because they feel that they can't afford. So communication, talking with people, when everyone had to make appointments, for example, on the internet, that's when we just went, you know, into action because people didn't have access to internet. So just basic communication. It sounds simple, but it is important. Melissa talked about show and tell. We invite electors to come out to see the work that we're doing in the community through the vans, through the distribution of literature. And that encourages them to provide money for preventive programs and education in the community. So it gets all tied together in order to impact the lives of the people we want to, you know, serve out there. So come out, look, listen, engage, and I think it will make a big difference, hopefully, in how to create more political will and then, you know, establishing policies and budgets to get a lot of this done. It's doable.
Well, I love show and tell. Thanks again to Kevin Fahey for that question, but also thanks to Dr. Irfan Asif, Associate Dean of Primary Care and Rural Health with the University of Alabama at Birmingham School of Medicine. I hope you'll come back. Great conversation. Virginia Fields, founder and CEO of the National Black Leadership Commission on Health, and also the former president of the Borough of Manhattan, which I just think is so cool. And Melissa Schulman, Senior Vice President of Government and Public Affairs at CVS Health. Thank you so much for joining us.
Thank
you.
Thank you.
And now for a message from our sponsor, Partnership for America's Healthcare Future. I'd like to introduce Lauren Crawford Shaver, Executive Director of the Partnership for America's Healthcare Future.
Thank you all for joining today. My name is Lauren Crawford Shaver, and I'm the Executive Director for the Partnership for America's Healthcare Future. First, a little bit about the partnership. We're an organization that's come together with all assets of healthcare across the community, from hospitals to physicians, to health insurers, to pharmaceutical companies, to patient groups, and to other advocates, looking and focusing on building upon what works in our healthcare and making sure to fix what doesn't. Simply put, we see Medicare, Medicaid, employer-sponsored insurance, the marketplaces, all coming together and to do their own part to strengthen our current system. Today's conversation is going to be one that focuses on our 5 tenets of things that we think are really important in strengthening our healthcare system. That includes expanding access, improving quality, protecting our most vulnerable, strengthening employer-provided coverage, and preserving control. With me today, I am joined by Philip Morris, partner at Locust Street Group, and also the exclusive pollster for the Partnership for America's Healthcare Future. We also have Jeremy Nagosian from FTI Consulting, one of our research partners who has continuously helped us analyze real important questions that look at access and cost questions when it comes to healthcare. I'll open it up to Phil over at Locust Street, who does a lot of our polling. Why do you think the favorability ratings of our current system are at record highs right now?
Well, Lauren, I think there's really a few factors at play when we think about why we see such high levels of favorability First and foremost, employer-provided coverage and private coverage through the exchanges enjoy broad support by those enrolled in them. In our most recent Voter Vitals survey of 2,000 likely voters nationwide, 75% of folks with employer-provided coverage or who purchase coverage through the exchanges are satisfied with their coverage. As we try to understand what's driving that favorability, I think there's really two primary factors: affordability and choice when it comes to coverage. Thanks to competition among insurers, expanded subsidies to purchase coverage, Americans have access to a wide array of coverage options to choose the one that's best for them and their family. All of our polling is clear that voters want choice and control over their coverage, not a one-size-fits-all system.
Jeremy, a question for you. Some of the research you've done for us has looked at ways to enhance our current healthcare system and increase coverage while lowering costs. Can you provide some more details and some findings from your research?
Of course. So we've looked at a number of policies that have been discussed across the country that are intended to improve the healthcare system in the US. We've found that just enhancing subsidies or taking the system we have today, the exchanges, and trying to focus on the people who don't already have insurance by just increasing the amount of subsidies being provided, we can increase coverage by over 1 million people. In addition to that, expanding Medicaid for the states that haven't already done so, that could insure an additional 1.5 million people. So all told, combined, those two changes could increase the number of insured Americans by over 2.5 million people. So looking at that and comparing that to enhancing subsidies or expanding Medicaid, we found that the public option, while it would increase coverage, it wouldn't add the numbers of insured that the other two would add. So we found that in comparison to enhancing the subsidies and expanding Medicaid, a new public option would increase coverage by less than 2 million people. And one of the issues with the public option is this would require an entirely new system to be set up, which could also lead to reduced access for Americans that already have coverage.
Thank you very much. So I want to go ahead and turn it over to Phil for a second. What are some of the clearest wins, if I dare quote there, in healthcare over the past decade that have increased voter support for our current healthcare system?
Well, I love that you put wins in air quotes there. We obviously can't make everyone happy, but I do think that from our polling, there are two clear wins in terms of the vast majority of folks really supporting and rallying behind these and feeling that the industry has delivered in a big way. And I think the first of those was certainly the passage of the Affordable Care Act, which did a few critical things. It guaranteed coverage for pre-existing conditions, its most popular provision by far. It created the marketplaces that gave consumers more choice and more options for coverage. And it expanded Medicaid eligibility, as Jeremy was talking a little bit about before. And I think all of this increased access to affordable coverage for millions of Americans, and importantly, did not threaten private coverage that we know millions of Americans enjoyed before and continue to rely on today. I think the second in terms of wins was really the COVID-19 pandemic. Obviously, this pandemic was a once-in-a-century event that required a coordinated government and private sector response. And I think our polling is clear that voters perceive the healthcare industry as being highly effective in addressing the pandemic. And so what it really boils down to is you have a scenario in which the federal government worked together with the industry in quickly adopting a number of other measures. And I think this was a prime example of private plans, public programs, and the industry as a whole working together to meet the needs of Americans during a really critical time. And I think that's exactly what we see voters are looking for in all of our polling.
That's interesting. Thank you, Phil. And you're right. These are two, well, we should call them pivotal points, not necessarily wins, where we've built on and continue to test our healthcare system. Thank you. All right, Jeremy, here's the question that I think everyone who does economic research on healthcare gets. We know that voters are concerned about healthcare costs. What kind of savings are we looking for Americans if we keep building upon our current healthcare system with enhancements like those you looked at in your research?
Yeah, well, I've talked a lot about how these enhancements might increase the coverage rate, but the other effect they're going to have is on the people who already have health insurance, it's going to lower their premiums. So we found that the enhanced subsidies, and this depends on what level of income a person falls under, but the reductions in their net premiums could be higher than 25%. And in dollar figures, that's more than $150 per month. So it could have substantial savings for people who are currently insured.
Excellent. Thank you for that. All right, Phil. Some polls claim that the government healthcare or single payer are increasingly popular. Your polling and what you've shared with Voter Vitals here does not say that. Why is there such a discrepancy between what you're saying and what you're seeing and what you test versus what other groups are pushing out?
So I think this is a really important question because the way polls ask these questions makes a world of difference in the results that they achieve. It's critical that any description of single payer is clear and unbiased to avoid skewing the results one way or another. And I think if you look at every single poll that shows high levels of support for Medicare for all or for single payer, they do not at all make clear that it would replace or eliminate private health coverage. They also don't mention that it would be funded by taxes. And when it is made clear to voters at a minimum that it would replace private health insurance, support is very limited for these proposals. A majority, in fact, do not support them. And the more that voters learn about these proposals, the lower their levels of support.
And I think one important point, Phil, is that most Americans agree that we do have a desire to make sure everyone does get coverage. They do not oppose that, but there's just different paths to making sure that happens or making that a reality for everyone. And that's really what's at stake in the question here.
Yeah, I think that's exactly right, Lauren. The end goal, there are a few areas of bipartisan agreement these days, but there is bipartisan agreement on the end goal being increasing access to coverage for every single American, and not just any coverage, but coverage that's affordable and high quality. And where we see this debate is just over how do we achieve that. And what's remarkable is there's even consensus still among Americans around how we should do that. And that's building on what we have today to expand or increase access to coverage and care. What a majority of voters are looking for is not to create something brand new. It's not to start from scratch. And it's certainly not to move to a government-controlled system.
Thank you, Phil. All right, Jeremy, I have one more question for you, and then I think we're nearing our end of time here. When we think about the future of healthcare, is it fair to say there will always be a push and pull around access and costs? I know that's been a lot of the research you've done with us. If it's not those two, what else is it going to be about?
Well, I'd hesitate to say there will always be a push and pull, but I think for the time being and for the foreseeable future, there's definitely going to be this push and pull. A lot of the plans, especially like the public option or even Medicare for all, the way that they're designed to increase coverage for Americans and save costs is simply by reducing the amount of money they're paying providers. And that reduction can have unforeseen consequences on access to those providers. So some providers may be able to reduce their costs and possibly at the expense of quality of care. But other providers are already on the edge of bankruptcy, and any reduction in payments to them could cause them to go bankrupt.
Thank you. Well, I really appreciate your time today. I'm glad we've had this conversation. There is certainly so much still happening in healthcare now, will continue to be happening. I think to the important point at the beginning, people like our current system. It's not perfect. There's definitely room for improvement. And as we look at those improvements and we consider those plans, we have to ask ourselves a really important question. What is this proposal and what is this plan trying to solve for? And what are the potential unintended consequences? And then we need to actually weigh in and view what those plans are. So I know this is many conversations in the future that we're going to be having as it relates to this. And I look forward to working with you, Jeremy, and Philip in doing that. Thank you all for joining.
Thank you, Lauren, Philip, and Jeremy. I like that line, increasing access to coverage that is high quality and affordable. is pretty much a North Star for people, no matter where they are in this healthcare debate. So just question of how you do it. Earlier today, I had a chance to speak with Congresswoman Robin Kelly from Illinois, who serves on the Health Subcommittee of the House Energy and Commerce Committee. She is also chair of the Congressional Black Caucus Health Brain Trust. Here's my conversation with the Congresswoman.
Congresswoman, great to be with you today, and thanks for joining us. Today is an interesting day. Vice President Kamala Harris put out a statement just a couple of hours ago saying this is the first White House Maternal Health Action Day. And I know you care about maternal health, and maternal health in the United States has become a real crisis, which is shocking to me in the United States of America. But can you tell us what the gaps are that Build Back Better, that our policy needs to fill, that our viewers need to know, what our healthcare system needs to fix?
Well, I'm thrilled to report that the Build Back Better bill makes permanent something that we passed in the American Rescue Plan, which was my piece of legislation where the Medicaid postpartum period goes from 60 days to 12 months or 1 year. Many times when women have a baby, we think that they may lose their life or get sick the day they have the baby. But many women, it may be 3 months later, 4 months later that they still feel the effects of having a baby. And we want to make sure that they can go and get medical treatment when they need it, not be able to go because they can't afford it. So it's very important that this extension is created, and that now under Build Back Better, it will be permanent.
It's fascinating. And I talked to Representative Alma Adams the other day about the Momnibus bill and the various dimensions of this. But it brings that to the forefront, I think, a bigger issue, which is a lot of Americans, if you poll them, healthcare and how to fix healthcare is a very high priority. If you go into the details, their eyes glaze over because it's a complex, just to be honest. But I think, the big question is for many Americans, where do we go from here? And my view is, you can think about strategic leaps. And we've seen, and maybe in science, something like immunotherapy or, what we did with Operation Warp Speed and vaccines coming on are strategic leaps. So might Obamacare have been a strategic leap. But I'm interested in what we need to do incrementally to fix America's healthcare system, and what was on your dashboard when it comes to how we deliver better health. We look back in 2 years, 3 years, we said we did something better than we're doing now.
Sure. Well, first and foremost, I'll say we have to, which Build Back Better deals with, lower healthcare costs, because you can have the best healthcare in the world, but if people don't have access to the healthcare, then it does no good. And COVID put a bright spotlight on the inequities in healthcare. The other thing is we're very interested in is eliminating disparities and inequities. We're interested in increasing the diversity in the healthcare workforce. There's been many studies that show that you do better when it's someone that looks like you, or at least understands, the reality of the situation. I would like to see, which COVID helped lift up, is telemedicine and telehealth, that if you can't necessarily travel, your doctor can come to you. I'm married to a doctor, and was not really familiar with telehealth, but then when COVID started, he uses it all the time now. So, I think those are some of the things that, we can work on and get accomplished, maybe not diversifying the pipeline so quickly, but telehealth, lowering cost, and things like that we can do. And we can start to eliminate disparities and inequities.
Well, I happen to believe very strongly in telehealth myself. I've never really liked going to a doctor, but it's become a little bit easier for me personally online. But you get at something that is so important for Americans to know about, is that where you're born, what zip code you live in, is the biggest determinant when you look back on someone's life of how long their life is, what their life expectancy, their health, et cetera is. And so I've wondered whether telehealth gave an opportunity to jump out of that and to sort of, as you said, to generate greater equity and fairness and justice in the health system. But how stable is telehealth, the reimbursability of it? I hear that it's wobbly in the insurance world, but what do you think about that? Because I know we're still in the crisis, folks, but telehealth is one aspect, but there are a lot of people that fear that Medicare, that others may not be solid when it comes to reimbursability down the road.
Well, actually, we have legislation that evaluates what has gone on with telehealth, the good, the bad, the ugly, what needs to be improved, what worked well. So we have legislation for Congress to look at that so we can improve where improvement is needed. Right now, the reimbursement is like as if you're going to the doctor, but it's only because, we're under a crisis. And I know there's other legislation that members have put forward that the reimbursement stays the same. So doctors are embracing it, and we have to look at this as a Congress to make sure that this was almost a silver lining that came out of COVID, that there's different ways to take care of somebody that people seem to embrace. So, again, we have legislation looking at all of this to see how we go forward.
Congressman, I know that, your district in Illinois, healthcare is such a, major concern for folks. Have you found when I talk about the healthcare ecosystem, there are a lot of players, right? They're the pharmaceutical companies, they're the doctors, they're the health providers, they're, pharmacy benefit managers and insurers. There are a lot of players in this world. Have you been able to develop an awareness and connection with them so that when you talk and identify problems, you see this health ecosystem responding or not?
I feel like I have a good relationship in DC and back home with the ecosystem, but I also feel like, people are still a little bit in their corners. And I've often said to the various groups, I wish we could come together, no hearing, no cameras, and just put everything on the table, and solve this problem of how expensive healthcare is in the United States of America compared to other countries. And I know, we do the research and we're the ones that come up with the innovation. So of course that costs money. But then on the other hand, if you don't have insurance, a pill that costs, I'm just throwing it out, $10 can cost $300. And it's happened, to me and my husband when they couldn't find, my insurance card. And I'm married to a doctor, an anesthesiologist, as a matter of fact. But it's happened to us also where we see, the difference in price if you don't have, some type of coverage. So you can see why, people may feel like they have to choose between paying a bill and getting medicine, or, some people have said eating and getting medicine. So we have to, close this gap. And also that's another thing that Build Back Better does, helping to close the healthcare gap in 12 of the states that didn't take advantage before. And that covers about 4 million more people that will have health care. And in my opinion, the more people that have health care and the more prevention we can do, at the end of the day, that saves us so much money. People are not going to the emergency room as their primary doctor.
Another thing you do in all of your spare time is that you chair the Congressional Black Caucus Health Brain Trust. Tell us what the Health Brain Trust does in the CBC.
Right, we're the healthcare policy advisors. I won't say experts because, we have nurses that are in CBC. So I won't say that, but we kind of do the groundwork, like something we just passed out in the last CBC meeting was about HIV and reminding people that it has not gone away since December 1st was AIDS Day, World AIDS Day. And then we laid out, what areas are highest in AIDS. And unfortunately, some of my colleagues have some of those areas and how we can work together for education and awareness for citizens, just like maternal mortality. I've done so much work around that, but all the issues, COVID, we've put on seminars and done different things like that. It's really to enlighten my colleagues and help them with things they might be able to do in their districts. I've traveled to different places like with Steve Cohn, we did something in Memphis on maternal mortality and infant mortality. Val Demings has a high rate of AIDS in Orlando, believe it or not. I would never think that. So I went down and did a health fair with her. I've done things with Congresswoman Barbara Lee and Maxine Waters. We've done things around the country to try to highlight issues that need to be worked on or an issue in a particular area.
You know, two of the people I've spent a lot of time with lately are Dr. Wayne Frederick, who's president at Howard University, and Michelle McMurray Heath, who is the new president of Bio, and both are Black scientists. And we've talked a lot about how many Americans in communities of color don't see people like themselves in the health system. You've referred to that as well. Talk about the talent and how to do it. And I believe for Dr. Frederick and also for Michelle, Dr. McMurray Heath, it's a real priority to begin changing, to getting real diversity, in the healthcare system. And I'm just interested in what can Congress do, or what can the federal government do to help enhance opportunity for young people as they're looking at the options they have, and get a more diverse workforce within the healthcare system, not just as nurses in front. We know those heroes, but as doctors and scientists and those that are, also financially on the upper end of this profession.
One part of it I do feel, and I tell people in the healthcare arena, they need to go back into the schools. This is not Congress, in elementary school and junior high school, not wait until college, not wait until high school, but expose young people. And I'm very proud to say that one of the federally funded healthcare places in my district, they started this year an internship program with younger kids. They had 14 to 16 younger children come in. She just told me this not too long ago, and the kids loved it. They loved the exposure. We have to expose, young people and, get them interested in what the possibilities are. I have a neuroscientist, Black female neuroscientist that works in my office. And then I have another, my chief of staff is getting her doctorate in public health. I have a master's degree in counseling and have worked in a hospital some of my career, but we have to expose younger people to it. But the other thing that Congress can do is around how much it costs to go to any type of postgraduate education. College itself is expensive, but if you go on, that's where you really have to pay a lot of money. So perhaps something we can do around that. And just like we on the Hill, we bring Black students to be our interns and fellows, maybe perhaps increasing that possibility where you get exposed to everything. I've had docs work for me, people going to be doctors, just all kind of people because of the brain trust. But the cost is forbidding. And then depending on what schools you go to, you may not even be able to get the exposure.
Let me ask you one last quick question, Representative. One of the barriers, I think, to the investments that you and many of your colleagues want to make, and I've talked to Brad Wenstrup and Debbie Stabenow, mental health, but also, obesity, various other chronic conditions, that are facing Americans, is that, you can model what the benefits will be if America took certain actions, you provided certain therapies. But the way that the costs of these are scored is only the expenses are counted, not the savings, that come over time. And I'm wondering whether there's any hope of beginning to be able to register the predicted savings, that come financially from having a healthier public, if you will. Because if you don't, and you're only counting on one side of the ledger, aren't you undermining your ability to invest in American health?
I definitely think you bring up an excellent point. I think because that's what you hear people say, that'll cost too much money, that will cost too much money. But we have to begin to look, at the savings. When I even think about other things we would like in Build Back Better, like dental, to save people money on dental, because if you have to go to the emergency room for dental, we've talked about this back in Illinois with my healthcare advisory group, the difference in cost is ridiculous, and I know in ENC, a while ago, we talked about, what savings that this can bring. But yeah, we have to develop a system where savings is included as we score.
Well, listen, Representative Robin Kelly, Vice Chair of the House Energy and Commerce Committee. She's the member of the Health Subcommittee and chair of what I think is really cool, the Congressional Black Caucus Health Brain Trust. Thank you so much for sharing your views with us today.
Thank you so much for having me.
I really like that chat. Thanks so much to Congresswoman Robin Kelly. I also spoke with Senator Debbie Stabenow from Michigan, who serves as chair of the Finance Subcommittee on Healthcare. We've got all the important folks in healthcare in Congress with us. Take a listen to my conversation with Senator Stabenow.
Senator, it's so great to see you again. Thanks for joining us to talk about, really, really important issues which you've been working on for a long time. And I would be remiss if I didn't say right on the front end of this, condolences to you and your constituents and people around the country for what just unfolded in yet again, another gun violence incident in schools. And this just raises an issue I have talked about so much, is how do we improve and up our situation when it comes to alertness and understanding where people are and mental health? What is missing? I don't know if you see a connection between that work and what unfolded, but certainly the stress of what just unfolded is hitting a lot of folks.
Well, see, first of all, it's wonderful to be with you as always. And while we don't know all of the specifics on this particular situation with the 15-year-old and so on, there is no question that we have got to strengthen what we're doing around mental health services in schools. We have school-based health clinics right now, but they are not funded as they should be. I have a bipartisan effort that we've been pushing to get increased resources into schools now because of COVID. When I talk to school superintendents and say to them, what's your number one challenge? They say mental health. And so because of all the challenges of children in so many ways around, not being in school and being on Zoom and coming back to school and just a lot of normal pressures in addition to everything else going on. And then you add to that the stress. In talking to teachers at Oxford, it breaks my heart. I mean, the immediate situation here, as well as parents and so on. So the community behavioral health clinic framework that you and I have talked about so much, that Roy Blunt and I have championed, is part of the solution, making sure that we have the community-based resources fully funded, like we fund healthcare below the neck. It needs to be comprehensive healthcare. And I will say that the Build Back Better effort that we're working on to get done by the end of the year takes a huge step because it opens up full funding for our community behavioral health clinics to states across the country for the first time. So it's very important.
Well, thank you for that. And I wanted to ask you about Build Back Better, because Build Back Better is basically, in my view, a real conglomerate of stuff now. There's so many elements to it. And frankly, it's hard to keep track of what's in, what's out, what it will do. And I guess as we sit here today and talk about what's strong in our healthcare system, what's not strong, what are the planks that are missing, I'm interested in what you see that Build Back Better specifically brings to America's healthcare picture that are big jumps forward.
Absolutely. This is really important. And when you look at all of what we're talking about, bottom line, first of all, it's about lowering costs for people, the kinds of things that keep you up at night, like the cost of prescription drugs. So it's lowering costs for people and costs that have been around a long time. And then secondly, investing in the future for our kids and for our economy. That's what we are doing in this package. And so on the healthcare front, highest costs that we have as taxpayers and as individuals in the healthcare system, prescription drugs. And so we are taking major steps to begin to negotiate lower prices, to put a $2,000 cap for seniors on how much they have to pay out of pocket per year under Medicare, to stop price gouging. Right now, prices are going up 3 times faster than inflation every year. We're going to cap that at inflation. And really, and importantly, we are putting a cap on the cost of insulin to $35 a month for your child who's a diabetic or yourself. Right now, average costs are something like $600 a month. And so we're lowering costs. We're going to lower costs on the Affordable Care Act, healthcare provisions. We started that in the American Rescue Plan. We want to keep those costs low. And we're going to tackle a number of things like home care, community-based care. We see families caught on both ends, that they're juggling children and the cost of childcare on one end, costs of taking care of mom or dad or grandma or grandpa on the other end. And so lowering those costs for folks is going to make a tremendous difference.
Do you sense that there is a tension, as we hear from some people in industry and in the healthcare ecosystem, that there's a tension on cost capping, some parts of that world versus innovation and continuing to get the big strategic leaps we've seen in innovation and drugs and whatnot? What are the trade-offs you feel, and how do you keep both sides of the equation robust and working right?
Sure. Well, I've worked in this area, particularly around prescription drugs, for a lot of years. And there's no question we have amazing innovation. And what we've seen with the vaccines is just one example. But I have to say that we as taxpayers help pay for that. The basic research that allowed this to move forward as quickly as it did came from the National Institute of Health. It came from, we've had in the last some 10 years, $200 billion or $300 billion plus dollars being given to drug companies and others to help, to pay for the research. So we're doing that as taxpayers. We're paying for the research. We allow the companies to deduct the cost of research as a business expense from their taxes. So we contribute again to support them. And then all that I ask is that we can afford the medicine at the end of it. And I think that's a reasonable thing when we see that American taxpayers, American consumers pay more than anybody else in the industrialized world for our medicine. And it's not necessary. The companies make a profit in every other country. They can just do more in our country. So I support innovation. I'm a huge a proponent of that piece of it. But I think it's disingenuous when they are saying they're going to have to cut research if we want reasonable prices and can afford the medicine. Because the truth is, taxpayers are playing a major role in funding that.
Let me ask you another question. We've been talking about the mental health side of this, you, Senator Blunt, myself, for years. And one of the things, and this is my editorial view and editorial opinion, is that there was a time in America's healthcare system where the economics of healthcare didn't leave much space in private healthcare or anywhere else for mental health and behavioral health support, work, attention, resources. And one of the goals of Affordable Care Act was to begin focusing on wellness, whole health, as opposed to fee for service. I kind of lost track, to be honest. This is an unfair question for a U.S. Senator. I should be asking a CEO of a major healthcare system. What do the economics now look like? Is whole health getting the economic platform it needs that includes health above the neck?
Well, it's moving in the right direction. And there's a number of things. Focusing on wellness. We now pay for a once a year wellness checkup for everyone under Medicare that wasn't paid for before. So you get that prevention, the checkup, comprehensive checkup. We need certainly to be doing more of that. I authored the provisions in the Affordable Care Act to require that insurance companies are funding mental health and addiction services the same as physical health. But frankly, it's a hodgepodge as to whether or not that's really happening as it should right now. But when we look at the economics, the interesting thing about healthcare is you don't save money when we cut services to people. We actually save money when people can get the healthcare they need, particularly comprehensive healthcare. For instance, expanding Medicaid. In Michigan, we were part of the Medicaid expansion effort that got folks out of the emergency rooms and into the doctor's office. And the state of Michigan, in the first year, I think, saved some $400 million on paying, less than they were paying for folks that were really sick sitting in the emergency room. And so health systems benefit when people can get to a doctor, or whether it's a physical doctor, whether it's a psychiatrist. If you can get help on the front end, you are saving money for the healthcare system rather than picking up the pieces. And on behavioral health, we now have very specific numbers showing that we're keeping people out of jails that because they can get help. The 24-hour psychiatric crisis center, we don't leave law enforcement in a position where they don't know what to do with someone who's got a problem, so they go sit in jail. And so there's a whole range of ways in which we save money for all of us by helping people get the services they need when they need it.
Senator, I'm one of these people that looks at our experience during the pandemic and seeing the heroes on the front line, the healthcare workers, the hospitals, the innovation in the pharmaceutical industry to get vaccines at a miraculous rate, et cetera. All of that dimension is something I feel we should be proud of. Now, I know that that's a controversial statement in some parts of the country and some parts of Michigan, but that's just the way I see it. But I'd be interested in your insights into, a pandemic doesn't come along every day, but we're in the middle of it. We're still in the middle of it. What lessons should we be drawing regarding public health and our health infrastructure that we ought to be learning from now and not forgetting when we get to the other side of this?
See, this is really important. And first and foremost, that we need to be prepared. We didn't have the stockpile for medical equipment, the basic masks and gloves and gowns. And recently, I organized a meeting for Senate colleagues to meet with the folks that do preparedness in Health and Human Services. And they are dramatically ramping up what we have just in terms of medical supplies and so on, because we saw what happened when we're trying to get medical supplies from around the world. And I spent a lot of time trying to find a guy who knew a guy who knew a guy in China, Michigan. I mean, literally. And so we're in a situation where we have to be prepared, and you can't skimp on those resources. We also have to make sure we are making that in America. And so we're now making the gloves in America. We're now making masks in America. We're now not dependent on international supply chains. We also need to focus more on prevention. I've been in county government overseeing the public health department. I've been in state government now federally. It's so easy to cut prevention because you don't see it. It's not the crisis right in front of your face. And yet we know that public health infrastructure, the capacity to move quickly in a crisis, is very, very important. So there's a lot of lessons, and I give great kudos to everyone involved in the vaccines developments. And we certainly need to continue to be investing in the new innovation, but we've got to have those systems in place.
Well, we'll have to leave it there. Senator Debbie Stabenow, I want to remind our audience, is chair of the Health Subcommittee of the powerful Senate Finance Committee, and she's on these health policy issues all of the time and never says no to the Hill when we call. So Senator Stabenow, thank you so much for joining us today.
My great pleasure. Take care.
Thanks again to Senator Debbie Stabenow. That brings us to the end of our program today. A really big thank you to the Partnership for America's Healthcare Future for its support, and to all of you attendees for joining us for these discussions. For anybody who missed this today, we're going to have the video up from the event on our website shortly. I'm Steve Clemens. Be well.